Everyone ready? All right. So good morning, everyone, and welcome to Cedars-Sinai. I'm Peter Slavin, President and CEO of Cedars-Sinai Medical Center and Health System, and it's a great pleasure for us to welcome Governor Newsom and his team to talk about access to medications for some of our community's most vulnerable patients. At Cedars-Sinai, we believe that quality care, including access to affordable medications, should be available to everyone in our society. And as the largest provider of services to Medicare patients here in California, and one of the largest providers to patients covered by the Medi-Cal program, we're excited to have the governor here to discuss this important topic. And with that, I'm going to turn the podium over to Alan Cockle, who is the Chief Government Affairs and Public Policy Officer of Civica RX. Thank you.
Thank you, Dr. Slavin. Thank you to Cedars-Sinai for hosting us today. I'm honored to be here and to work together on this mission of affordable insulin with the state of California. 8 million Americans and more than 1 million Californians depend on insulin every day. For them, insulin is a life-saving medicine, not a choice, not a luxury, and it's not something they can cut back on when finances are tight. At Civica, we believe that insulin should never be out of reach for those who need it. Civica is a non-profit generic drug company. We were created by American hospitals to ensure a reliable, safe, and affordable supply of essential medicines. We've delivered more than 200 million vials of medicines to hospitals around the country already. And we've expanded our mission in partnership with health plans, including Blue Shield of California, into ensuring affordability at the pharmacy counter. Today, we're pleased to be partnering with the state of California to announce the upcoming launch of insulin glargine, a long-acting insulin that's interchangeable with the brand Lantus. It is the most used insulin in the United States. Here in California, this product will be available with the CalRx label. In the rest of the country, it will be offered as Civica insulin. Our goal is to deliver savings to the consumer at the pharmacy counter, and so we've priced this product at $45 for 5 insulin pens. That is the lowest list price available for insulin glargine. We've also established a maximum recommended retail price of $55 for 5 pens. That's the most anyone should ever have to pay, even if they show up in the pharmacy without any insurance. And for full transparency, we've put a QR code on the package that links to that maximum price. Of course, for someone with insurance, their out-of-pocket cost may be much lower. CalRx insulin will be available to be ordered and dispensed by any pharmacy in the state, and every health plan can choose whether to include it on their formulary. At Civica, we appreciate the support of Governor Newsom and the state in this goal of quality, affordable insulin, and we appreciate our other funding partners, including diabetes organizations, foundations, health plans, health systems, and other governments. We're working together because we share this commitment to insulin affordability. I also want to acknowledge Biocon Biologics, our manufacturing partner, while Civica continues to work on our own insulin. And I want to thank a couple of wholesale distributors, Cencora and Cardinal, who have stepped up early to make sure that this product will be available in pharmacies. Working on affordable insulin, I know I've been touched, and I think everyone at Civica has, by the stories of people who've struggled to afford insulin. I recall one mother who talked about waking up in the middle of the night, unable or worried about running out of insulin. I recall another person who said, even though I have good insurance, I'm always 1 drop vial away from being out of insulin. Nobody should feel that way, and that's why we're doing this work. It's my pleasure now to introduce Nikita Colom-Harris, who's living with type 1 diabetes.
Hello, I'd like to just thank the governor and his team and the American Diabetes Association for inviting me back to share on this important topic of insulin affordability. I'm a proud native Californian. Even my mother was born and raised here in the 50s. Growing up in an industry that California is known for, when I was 12, landed the role of the original voice of young Nala in Disney's film The Lion King in 1994. And then flash to 1999, a freshman year in college. In an ICU room, the doctor tells me I have type 1 diabetes. I thought, not only is this a death sentence, into my career and dream of becoming a mother. I have given myself 67,333 insulin injections, 76,952 finger pricks, 2,748 days recovering from a hypo since being diagnosed in 1999. I was once out of insulin for 5 hours, and that put me in the ICU for 2 weeks. I am thankful I am even standing here today advocating as I have been since my first call to Congress with the ADA in 2011. I have a beautiful daughter who's turning 5 and my supportive type 3 husband. So I ask anyone before you say no or turn down funding to prevention measures and sustaining life tools, think of the mother who is deciding whether she is going to pay for groceries or her insulin. Think of that teen who is stretching out their dosage because the cost is making them feel like a burden. Or me, who now has neuropathy and gastroparesis only due to limited access to insulin and tools earlier in my life. Seeing the dollar signs drop in front of insulin costs, which is literally the vial of life for millions of children and adults living with diabetes, gives me hope in humanity. The scientists who discovered that insulin could save human life, those who invent and develop the medications and technology to sustain our lives, gives me hope in humanity. And the millions with diabetes, the allies, the caregivers, or T3s as we call them, give me hope in humanity. And so I just say thank you to Governor Newsom and the whole team behind this great effort and for being a T3. Next person who's coming up is also an advocate, Grace.
Good morning. My name is Grace Pang, and I'm a senior at Yorba Linda High School. I'm here today not only as a student, but as a daughter and granddaughter who has witnessed every single day how diabetes affects my family's life. I myself do not have diabetes, but it's always in the background of my home at every meal, every grocery run, and every single family gathering. Both my dad and my grandmother have lived with type 2 diabetes for as long as I can remember, and insulin has become as much a part of our daily routine as eating breakfast and brushing our teeth. My dad uses long-term insulin and travels often for work. Every time he's packing for a business trip, my mom always has to remind him, "Don't forget your insulin pen." One time, she didn't, and he actually forgot it. I still remember the panic that followed, my mom rushing out of the door in a flurry just to ship his insulin before the UPS store closed. This represents just how essential insulin is. It's funny looking back, but just a few hours without insulin could pose risk at my dad's health. My grandmother, on the other hand, has her own little routine. She uses both short and long-term insulin, and whenever she comes over for dinner, she puts it in a little cooler just to keep it effective, and before every meal, she takes it out, checks her dosage, and injects it with a calm confidence that can only come from years and years of practice. It's routine now in our family, almost ordinary. But for both of them, insulin is not optional. It's survival. Yet they each spend well over $100 each month for something they simply can't live without. I've seen how those costs can add up. The hesitation before refilling a prescription, the stress of balancing bills, and the constant worry of, what if it becomes too expensive one day? No family should ever have to live with that sort of uncertainty. Beyond my home, I've met countless families who face similar struggles. While volunteering in Santa Ana to address nutrition insecurity, I've met parents who had to make impossible choices between putting healthy food on the table and paying for the very medicine that keeps them alive. That's why actions the governor has taken on addressing this issue, including his recent signature of Senate Bill 40, means so much to us here in California. I'm proud that we are taking meaningful steps towards recognizing this life-saving medicine as what it truly is, a necessity, not a privilege. Today's announcement represents hope for my dad, my grandmother, and the countless families in California who rely on insulin to stay alive every single day. Hope that they can finally worry a little less and live a little more. Thank you. It is now my privilege and pleasure to introduce California Health and Human Services Secretary Kim Johnson.
Well, thank you so much. And I think there's so much power in what we just heard of real life stories and what it's like to live with diabetes and our commitment here in California to affordability. Thank you, Civica, for this partnership. This product launch really embodies California's vision of an equitable, transparently priced pharmaceutical market where all Californians can afford access to the medications they need for healthier lives. It also highlights our innovation. The CalRx initiative is one part of a much broader effort to make healthcare more affordable in California. CalRx's other initiatives support this vision and include improving albuterol access in schools for our children, making life-saving naloxone more affordable, and the bear is on the box. That's how you find CalRx and naloxone. And ensuring essential drugs like reproductive health medications are accessible in our state. Along with making access to medicines more affordable, we're addressing medical debt through the hospital bill complaint program. We can't make healthcare more affordable without investments in the workforce, and we are reducing workforce shortages by providing scholarships, loan repayments, and grants to students, graduates, and institutions providing direct patient care in areas of most need. We're also investing in our behavioral health system and working to make mental health and substance use disorder care more accessible and integrated into our healthcare delivery system. We've also established the Office of Healthcare Affordability in 2022, which is focused on slowing the growth in healthcare spending and addressing high-cost outliers. Today's announcement means that millions of Californians can rest easier, as you just heard, knowing that paying for insulin won't break their budget. It won't make them have that hard choice between housing, food, and education. Thank you, Governor, for providing another example of how California is leading the nation in increased healthcare access and affordability, and how we are disrupting the market for essential medicines. And with that, I welcome the Governor of the great state of California, Governor Newsom.
Thank you, Madam Secretary. Thank you, Madam Secretary, and thank you to all the speakers, and thank all of you that are behind the cameras that are assembled here today in the first of the nation announcement of its type. January 1st, we will be the first state to provide this not subsidized insulin, but lower cost insulin available to anyone and everyone at pharmacies and direct mail pharmacies all throughout the state of California. $11 per pen, $55 for a month's supply of this long-lasting insulin. It has been a long road to get here. This is a process that has unfolded over the course of the last 3 years, and it's a process that will continue to unfold over the next few years as we expand the portfolio of options as it relates to insulin and continue our partnership with Biocon and continue our effort to expand the portfolio of opportunities under this CalRx brand. And it's important to underscore, this again is part of a new initiative to fundamentally lower healthcare costs, not spread healthcare costs. One of the things that all of us should be increasingly concerned about is announcements around caps, announcements around discounts, announcements that fundamentally are simply subsidizing a direct cost and socializing the total cost to you and me and the entire healthcare system. There's a lot of mythology as it relates to how this system operates. And fundamentally, what we're doing is creating a pattern interrupt. This is significantly different than what others have done to achieve lower costs, because again, we are taking out the middleman and we are fundamentally reducing the cost to individuals, ultimately extending that to taxpayers themselves. And so I just want to extend gratitude to all of our partners to this process that continues, including some FDA approvals that are in front of us next year, to some trials in terms of our manufactured products that will be occurring overseas in the European Union, and the work that is being done in real time to expand the portfolio to diapers. We have 14. We have an RFI. It's a fancy way of saying a request for information that provided under the CalRx brand the opportunity for us to get in the diaper business, to lower the cost of diapers, to remove the middlemen, to lower costs. 14 folks nonprofits and organizations have already reached out saying they're interested. You heard about the work we're doing on inhalers that the Secretary just mentioned to get in all of our public schools. We've taken a component part of the appropriation that was made by the California legislature to advance those goals. And the naloxone box that the Secretary just put up, 160,000 units a month are being distributed throughout the state of California. And just a few months ago, we started to provide those naloxone boxes, 2 for $23, $24, making them available direct to consumer. It is ultimately our goal to do that with this announcement, to provide it online, but we'll start with the pharmacies themselves. Their cost, $45. They will have a $10 processing fee. That's it. $55 retail costs. Best in the nation. Nothing comes close. And let me end on that. Currently, if you look at the pricing that exists, the lowest pricing you can find is about $89. Average price north of $300, and you're seeing pricing as much as $411. That spread, current book, $89 to $411. Here now in California, starting in January, we'll get that down to $55. Not subsidizing, lowering the cost. Not socializing and spreading the cost. Simply reducing it for all users. Anyone can access this. You don't need a new prescription. You just simply transition to this biosimilar insulin that now is being provided under this first-in-the-nation branding, CalRx. I'll close with one additional thought because I want to build a little bit upon what the Secretary said. I'm particularly proud of the work that has been done in California over the course of the last 6 or 7 years. This is part of a larger mosaic of reforms that simply are not happening or taking shape anywhere else in the United States. And I'm not asserting that. I can prove that. There's no other state in the United States that provides universal health care regardless of pre-existing condition, ability to pay, or immigration status. There's only one, California. The expansion's one thing. Once you expand, now it's about quality. Now it's about access, and it's about cost. And as now we've shifted from the expansion mindset, we're now shifting to a wellness and health mindset. You saw that with ultra-processed foods and the announcement we made last week, first in the nation to provide 2 free school meals, $1 billion a year, 1 billion meals a year that we are providing our students in the state of California. It's not just access, it's quality. It's health care, not sick care. And it's access on the basis of affordability, creating the first in the nation Office of Healthcare Affordability, marking and striking a commitment to lower costs and drive through a regulatory regime to that goal, and then providing access to disrupt and bypass, I'll say it, Big Pharma, to disrupt this multi-billion-dollar market. 90% of insulins in this country, 90% share are in the hands of just 3 big companies, and they have been gouging you for years and years and years. They're also gouging Americans by 5 to 10 times what our European counterparts are currently paying. That's fundamentally what we're about, and this announcement is about, is fundamental disruption in this space. In the absence of the kind of leadership at the federal level, though there are some interesting announcements coming from the current administration, but they amount to press releases right now, not fundamental policy yet. In the absence of that, proud of California, our state, leading in this area. With that, we're here to answer any questions. And I'm happy to ask myself one question. And that is, no, I'm joking. I've never seen you guys so timid, so quiet. It's almost awkward.
Governor, your reaction to the Hamilton events planned?
Well, we'll see what actually takes place. We were under the understanding they were going to close I-5, up to 80,000 vehicles on Friday, tomorrow, and Saturday. then they seem to have backed off on that. They were going to move forward with a display doing something, but they're not clearly sharing that with state officials. It was foundational and fundamental that we needed to be part of that if we were going to shut down the freeway and make sure it was done in an appropriate manner. But it appears, as I said, they've backed off. So to be determined what they are proposing to do. We're proud of this country, proud of our military, proud of the 250th anniversary. Anything we can do to celebrate our vets, to celebrate our heroes, I'm all for. Let's just do it in coordination and collaboration with state and local leaders. That continues to be a struggle with this administration that is more interested in doing things to people than doing things with people in relationship to these kind of activities. There may be a top 20, but what the list of the next steps in terms of what you may see on the portfolio, the list under CalRx, the things we're thinking about and talking about.
Yeah, so the CalRx team has developed a list of drugs that we think are important to focus on. Certainly looking at vaccines, certainly looking at GLP-1s. As the governor and the secretary noted, albuterol is key. So those are some of the drugs we've identified, looking at cost, looking at prevalence of use, and looking at access. Right now, the naloxone is available. Insulin is going to be available in January. Albuterol is coming thereafter. And we don't have immediate plans for the other drugs, but we're certainly working on it.
But I love the question. And if you don't like the answer, ask a better question. And I'm not referring to your question. I'm referring to the questions we were asking ourselves. And we were as dumb as we want to be. We were constantly asking how to lower costs by subsidizing costs and spreading costs. And then we started asking a different question. And all of a sudden, CalRx was conceived. And now we're thinking, wait a second, we're the largest healthcare system in the United States of America. We're the largest purchaser in this country. Why aren't we taking these market-centered values, free enterprise, using our purchasing power, and act more like a damn business? And it's so interesting, all these folks that wax on about free enterprise, all these businesses that talk about the merits of free enterprise, they hate it when there's real competitors. And all of a sudden, they try to trip us up. They try to take us out. They try to put sand in the gears of our efforts, which I think is just highly ironic. So they've had this sort of favored nation status. And finally, our status is improving because we're finally in the game. So I'd love to see that list significantly expand. Once a mind is stretched, it never goes back to its original form. And what I mean by that is now we're open for business. People see that we mean business, that this is real, that this is finally happening, that we have real resources behind it. And no one asked, this was the question I was going to rhetorically ask, how much did this cost? We seeded this with $50 million in this first phase partnership. And we're looking to expand additional supports as proof of concept with the legislature. But the legislature is all in now. They see the benefits of this. And I think the door is opened to the opportunity to significantly expand that portfolio. And GLP-1s, I'll tell you, in terms of costs, that is an area of opportunity for us. And that is, for me, one of our prime targets with the sell-by date that I have in terms of my tenure that I want to accomplish before I leave.
Thank you. What kind of cost savings is this going to mean for Medi-Cal and CalPERS and the other programs?
Well, that's to be determined, and that's a good general question. And we've discuss that, so I'm going to ask the person I asked that question to answer it to you as well directly.
So the CalRx program buys all of their drugs directly, and so we're still in conversation to see how much this would be of help to them. So we are actively talking to health plans, talking to our own California purchasers such as CalPERS and Medi-Cal, and we don't have those exact numbers today, but we're absolutely seeing what the largest purchasing power can bring.
But look at the hope and goal here. And by the way, just Blue Shield, respect. They put this on their formulary. So we're already seeing some traction and action, which is exciting. We hope this disruption will lower, as you saw with naloxone. What we came in on the naloxone side, you saw significant decline in costs across the spectrum. That's the hope and expectation here as we can anchor in and we can start to see the cost curve start to move in a different direction and collapse overall.
Thank you.
Excuse me.
Do you have any thoughts on the upcoming No Kings events that are taking place this weekend, and any advice for those who might be participating?
Well, my advice is if you participate, do so peacefully, so thoughtfully, because there's one person that hopes you don't, that hopes there is disruption, there's some violence, and he will exploit that, and he will take advantage of that in a profound and consequential way. I hope people come out in unprecedented numbers. And I hope they do it not just for themselves, but for each other and for the 249 years that our founding fathers lived and died for, and those enduring principles that are at stake. No kings. A declaration of independence against the tyranny, against lawlessness in the context that there was no rule of law. It was the rule of the king. And I think increasingly people are waking up to the rule of law in this country, increasingly appearing to be the rule of dawn. And I hope it's dawning on people how precious this moment is and what's at stake. And so I hope people put a stake in the ground, take the opportunity and time to participate this weekend, but again, do so peacefully with a deep realization of the consequences and what the founding fathers were all about. Co-equal branches of government, popular sovereignty, the rule of law, fundamental values that have endured for 249 years, and all of that is at stake.
Last question.
When the insulin initiative was first announced, the state set aside $50 million for a manufacturing plant.
Yeah. We shifted last year with the legislature. We actually are using some of that money for our inhaler initiative in the public schools through CalRx. And we made the determination with Biocon that their existing facility in Virginia was more than adequate to provide enough manufactured product for the state of California. So that gave us the flexibility to investigate that alternative and option. And working with the legislature last year, we redirected a lot of those funds. So we're not doing it in that case. We're going to use the existing manufacturer in Florida and in Virginia. Yep. Oh, sorry. Yeah. Right. That's all coming, and that was a reference on the FDA approval and what's happening. Maybe you guys want to talk about a little bit about the fast acting and where we are with our clinical trials and where we are with the supply chain and tariffs and all those wonderful things. The reason I didn't get in your business.
So today we're announcing the launch of the long-acting.
Right here? Oh, thanks. Yeah.
Today we're announcing the launch of the long-acting insulin January 1st. But this summer we actually kicked off and made a formal announcement, the start of our fast-acting development program. So our first fast-acting will be insulin aspart. So it's in the works.
Yeah. So they're testing it. We'll go through a process January, July. We hope to be out of those tests, and then we'll in the formal FDA approval process. I'm mindful of the clock, but we're now we're very mindful that we're now on the other side of some of those delays, and they're finally moving forward, and so it's taking shape. Well, if you break the law, you're subject to the laws of the state. Just because you work for a federal authority doesn't mean you can't be mindful of state laws. For example, speed limits. They're subject to everyone, regardless of your employer. So I didn't find anything curious, surprising about that, and I imagine that anyone would be subject to the laws of the state. As it relates to Donald Trump, he seems less interested in the law. It's clear violation of the law under posse comitatus to send the military to do domestic policing in the United States of America, period, full stop. Anyone, even without a law degree, knows that, and most federal judges have adjudicated accordingly. only to see some sand in the gear put at the appellate level as we await ultimately the determination from the United States Supreme Court. But we have been very aggressive and in our efforts in pursuit of the rule of law and justice as it relates to these illegal acts of the president. His latest assertion that he was going to come to San Francisco, on what basis? He didn't even claim. There's no pretext anymore. Let's disabuse ourselves that there has to be a pretext with Donald Trump, that there's anything that would justify that. There's no existing protest at a federal building. There's no operation that's being impeded. I guess it's just a training ground for the President of the United States. It is grossly illegal. It's immoral. It's rather delusional. And increasingly, this president appears unhinged, unmoored by reality and facts. Seems listless. He seems, dare I say, in decline, cognitively and, dare I say, forgive me, perhaps unfair, physically. And these are just rantings of someone that needs an intervention, needs some help, needs to be stabilized, dare I say. Well, as you know, laws are pretty clear in terms of the responsibility and accountability. Once someone has been accused and ultimately found guilty of these laws, they will be held to the letter of the law, and they should be prosecuted, period, full stop. But on the fundamental issue, I would refer to you to some of the work we've been doing in partnership with local government. Now, let me highlight two specific examples. An additional $1.1 billion of new grants that we provided the DAs across the state, sheriff's departments across the state, as well as local police departments that are part and parcel of a crime safety plan that focuses on retail theft, focuses on petty theft, focuses on car break-ins, vertical prosecution grants, hundreds of millions of dollars that we've distributed over the last few years to help support the investigation and prosecution of those crimes. We also recently built on a very successful program we've done in San Bernardino and Bakersfield, specifically launched in San Francisco and Oakland a few years back, and that is our effort to saturate with the California Highway Patrol these preemptive strategies with our strike teams to address some of those concerns around crime and violence. We recently announced those enhanced partnerships here in LA just a month or so ago, and we're going to continue to make those investments on the backs of the fact that we have now over 1,000 new California Highway Patrol officers that we've recruited over the course of the last few years, the largest recruitment class in decades in this state. And so we're doing everything we can to help support local officials financially and support them with partnerships with state law enforcement.
Thank you, everyone.
Governor, question on inhalers really quick.
Oh, good, okay.
Medical researchers
Thank you.
have
See?
talked about, concerns
I'm my inhaler expert, yeah.
Some medical researchers I spoke to recently are concerned about introducing greener options for inhalers into the market and what that can mean for large companies. What propellant is being used in the inhalers that you're creating, and is that going to match what's coming up in the market?
Great. Well, we're very happy to know about that. So we're in the process of taking proposals, and so that'll absolutely be a critical component of what we're looking at. So our goal is to get inhalers in every single school. Right now, folks, we have kids coming to school with asthma who have an asthma attack and don't have access. So we'll definitely take that into consideration and look at the components of the inhalers. Thank you.
Thank you, guys.